If your body isn't making any insulin or not making enough, it cannot convert sugars into fuel inside your body's cells. This condition is called diabetes, and it's a growing problem due to problems with exercise, lifestyle and diet. Diabetes is a condition where the amount of glucose in the blood is too high because the body cannot use it properly. Glucose comes from the digestion of foods containing carbohydrate and also is produced by the liver. Carbohydrates come from many different sources, including starchy foods such as bread, potatoes, fruit, dairy products, as well as sugar and other sweet foods that we eat. Insulin is vital for life. It's a hormone produced by the pancreas, and it helps glucose to enter the cells, where it is used as a fuel and energy for work and play. Generally speaking, our body will produce this, and the insulin acts as a key to unlock the body's cells so they can accept the glucose. There's currently around about 2.5 million people with diabetes in the UK, and more than 500 million people who have the condition but don't actually realise it. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes develops if the body is unable to produce insulin. This type of diabetes usually appears before the age of 14. Type 1 diabetes is the least common of the two main types and accounts for around about 5 to 15% of all people with diabetes. You cannot prevent type 1 diabetes. Signs and symptoms are things like exceptional thirst, dry mouth, frequent urination, loss of weight, weakness, tiredness and blurred vision. Type 2 diabetes develops when the body can still make some insulin but not enough, or when insulin is produced it doesn't work properly. This is known as insulin resistance. In most cases it's linked with being overweight. This type of diabetes usually occurs in people over the age of 40, although some South Asian and Afro-Caribbean people it can often appear as young as the age of 25. However, recently more and more children are being diagnosed with the condition, even as young as 7. Type 2 diabetes is more common and it accounts for around about 85 to 95% of all people with diabetes. Signs and symptoms are blurred vision, cuts and sores that take a long time to heal, itching skin, yeast infections, excessive thirst, dry mouth, frequent urination and leg pain. If treated correctly, diabetes can be controlled very well with insulin, tablets, diets, lifestyle changes. When things go wrong, there are two main conditions: hyperglycemia, when the blood sugar levels are too high, and hypoglycemia, when the blood sugar levels are too low. With hyperglycemia, this is a serious condition and you need to call for an ambulance as soon as possible. If they become unconscious, place them in a recovery position and monitor their breathing and their response levels. It usually occurs over a prolonged period of time, maybe hours or even days, and the signs and symptoms can include need for frequent urination, drowsiness, nausea, extreme hunger or thirst, and blurring of the vision. They may also have a fruity smelling breath. Sometimes this is referred to as the smell of cheap wine or the smell of pear drops. With hypoglycemia, sit them down, give them some sugary drink, food, fruit, or maybe just glucose tablets or gels. You need to monitor them, of course, but you will see that giving them sugar usually does bring them round fairly quickly. If they become unconscious, put them in a recovery position and call the emergency services. Signs and symptoms are usually very quick to show, and these can be things like shaking, fast heartbeat, sweating, anxiety, dizziness, extreme hunger, weakness, tiredness, and irritability. If you're not sure whether sugar levels are too high or too low, give them sugar. It won't hurt them. If their blood sugar levels are too low, giving them sugar will increase their blood sugar and you'll get a response fairly quickly. If they're too high, the body won't be able to use the sugar, so it's not going to actually do them any harm.